Tonight, local healthcare leaders are demanding immediate action on the healthcare crisis. They say that passing a trio of bills called the Healthcare Action Package will help ease the pain. Jake Holter tells us what's in the legislation. Jake?
Well, one of the biggest issues highlighted was Rhode Island's Medicaid reimbursement rate being too low to even cover the cost of procedures in some cases.
If we don't act now, it's going to continue to get worse.
Dr. Michael Migliori is the chief of ophthalmology at Brown University Health and oversees the residency program. He says with Rhode Island's current Medicaid reimbursement rates, it's nearly impossible to get residents to stay and work in the state since the reimbursement rates are 20 to 30% lower than in Massachusetts or Connecticut.
If it costs $50 to see somebody and you're getting $20 for an exam, you're losing $30 on a patient. So when the payments don't cover the cost of providing the service, you can't keep the doors open. And it doesn't matter if we raise our rates because the reimbursement is determined by the state.
Just last week, Providence Community Health Centers announced it will lay off more than 70 employees, citing, quote, inadequate Medicaid reimbursement rates and reduced funding. The bills these healthcare workers say would help the situation include the Family Health Care Act, the Health Insurance Fairness Act, and the Medicaid Reinvestment Act. State Senator David Tikoyan is sponsoring one of the three bills. He says the Medicaid Reinvestment Act would be at no cost to taxpayers.
It works with a reimbursement mechanism within the hospital fee. So every dollar that we invest, we'll get two in return.
On Community Focus Tuesday, Governor Dan McKee told our Kim Kalunian that they requested a rate study last year that didn't get approved and are hoping that study is approved this year.
Increases of reimbursement rates could potentially have impact on insurance rates that people pay, could have impact on taxes that people pay. So I think it's really appropriate to make sure that you have the right information before you do that.
But on Community Focus today, Attorney General Peter Nerona says he doesn't think that's necessary.
We certainly don't need to study the problem anymore. We know what the problem is. We don't have enough revenue in the system. Our reimbursement rates are too low. We need to raise them.
And Tikoyan says he hopes to get his bill on the floor by the end of the month. Reporting in Providence, Jake Holter, 12 News.